Welcome back. I'm joined now by Dr. Anthony Fauci. He's, of course, the director of the National Institute of Allergy and Infectious Diseases at NIH. Dr. Fauci, nice to see you. Let me start with the grim record we just set over the last 24 hours. Most cases in 24 hours yet at 77,000. What seems different this time, Dr. Fauci, is that there seems to be a lack of collective urgency about this latest peak. Where does this end? Are we going to 100,000? It feels like we are on this trajectory and have no way off of it right now. Where are we headed, sir?
Well, Chuck, I'm concerned about it. And the reason I'm concerned is that, as you mentioned, our baseline of community infections that you see every day, they've been anywhere from 20,000. Then they went up to 65, 70. Then they came back down to 40, 50. Now they're back up to the record that you spoke about yesterday at over 70,000. That is a precarious place to be for a couple of reasons. Because if you look at the map of the United States, and several of the states right now, for a number of reasons that we could discuss, are having what we call upticks in case positivities, which are in fact leading to increases in hospitalizations, which ultimately will lead an increase in deaths. And when you enter the season of the cooler months of the fall and the colder months of the winter, where a lot of activity out of necessity is going to be inside as opposed to outside, that's a difficult and challenging situation to be in, because you have a couple of factors against you. The amount of community spread, as expressed by the number of cases per day, which, as you said correctly, yesterday was at a very high level of about 70,000, as well as the increases that we're seeing on the maps of the country going into the colder season, is something we really need to appreciate. That we don't want to shut down the country. Every time I talk about things that we need to do, people get concerned that we're talking about shutting down. We're not talking about shutting down, but we're talking about doubling down on some of the fundamental public health measures that we need to adhere to: the universal wearing of masks, the physical distancing, the avoiding congregate settings and crowds, particularly indoor, doing things to the extent possible outdoor more than indoor, such as dining and things like that, to the extent we can, with the weather, and frequent washing of hands. They seem rather simple, Chuck, but they really do work. If you don't want the extreme. You don't want to say either shut down, right, which we don't want to do, versus just don't worry about it, just do whatever you want to do. There is a golden mean in there where you can do public health things that work, right, that can blunt these increases that we're seeing.
Look, at this point, though, it does feel as if politics is getting away. I've talked to the mayor of Sioux Falls, and I asked why is he not doing a mask mandate, and he basically said he just politically couldn't. So then you're hoping, well, can someone set an example? And Dr. Fauci, I know you don't love being drawn in to White House criticism, but I got to show you this Oval Office event today, sir. I'm going to put up pictures here. This is 30 people in the Oval Office while the president's on a speakerphone, and you're seeing nobody's wearing a mask. Not Ambassador O'Brien, not Jared Kushner. There's one woman there is wearing a mask, and that is it. 30 people, the size of that Oval Office. I mean, that is a violation of what a good practice is it not?
Yeah, I think what you're going to hear, Chuck, with some validity to it, but then again, the image is not optimal for people to see, is that virtually everybody who's in that room was tested that day to go into the Oval Office. But still, the image of that is something that may give the wrong impression to people.
Well, Chris Christie said I think regrets that they allowed the being tested. He thought it was a safer environment, and he said that's why he didn't wear a mask, and he wished now he would have worn a mask. Let me ask you this: how much of the country is in this so-called red zone, and how come the task force doesn't make this public for all of us to see?
Well, right now, if you're looking at it, there's a number of states, about 30 some odd states have picked up and ticked up into a level where they're increasing. That information, I think, could be public knowledge when Dr. Birx, who spends a lot of time collecting that data, she's right now on the road going to different states trying to get some public health message there. But I believe that that information can be made public. I don't understand why not.
Well, that's what we're wondering. We don't understand why it isn't either. It does seem as if that it would, and it does raise the question, wondering, does the task force not want it public? Is there fear of having people too worried about the virus?
No, I don't think that's the case, Chuck. I really don't. I don't think that the task force doesn't want it to go out. Being a member of the task force, I don't think that that's the case.
Tell me about task force meetings these days. How often do they occur, and who runs them?
Well, they certainly are less than they used to be, Chuck. We used to have them during the the early spring when things were really hot, particularly in the northeastern part when New York was having a terrible time. We were meeting, 5, 6, sometimes 7 days a week. That then sometime a few months ago, when things pivoted around to more of the economic reopening, as it were, of the country, the number of task force meetings have diminished, and we're averaging right now about one a week. We had one last week. I was involved in that this week, actually, and then as well as last week. We also have a governor's call that isn't an official task force meeting. By the way, you asked the question, the vice president who definitely is in charge of the task force meeting. And then the doctors, myself and Dr. Birx and Dr. Redfield and Dr. Hahn and others meet. We used to meet in person, but now virtually at least once a week. But an official task force meeting, Chuck, in the last several weeks has been about one per week.
And when was the last time you had the president at one of these task force meetings?
At a task force meeting, that was several months ago, Chuck, several months ago.
And do you brief him often anymore? Does he call you up? I mean, he says you guys still talk. How often does he ask you your advice? Do you feel like you have his ear as much as Scott Atlas?
I definitely don't have his ear as much as Scott Atlas right now. That has been a changing situation. We certainly interact with the vice president at the task force meetings, and the vice president makes our feelings and what we talk about there known to the president, but direct involvement with the president in the discussions, I have not done that in a while. You said what we need to do at this point to mitigate, if we could just do some of the basic, simple things. Is there a more robust federal role you'd like to see right now? And what would that be? If there's just one thing more that you'd like to see from the federal response right now, what would that be? Yeah. Chuck, it probably would be a more uniform direction of what states should do. One of the issues that we find that states do things a bit differently. I mean, that's understandable in many respects because we have a big country and the conditions in different states are different for so many reasons and regarding so many factors. But what I would love to have seen was a little bit more uniformity in what the states are doing so that you have a consistency so that everyone can look around, see what everybody else is doing, and be part of a country response as opposed to individual responses. Is that something that you think could still be put together? I say this, who knows what's going to happen in the next few months, but is that something that could still get rebuilt? I don't want to start second guessing about what has been done and what could be done. I've always felt that uniformity of response and consistencies of response is always a good thing. People know where they stand, know what they need to do. There were certain fundamental things that had not been adhered to consistently, and those were some of the 5 things that I mentioned to you. The degree to which you have more strict public health measures would depend upon the level of infection in a particular community, because you have to admit that this is a large country and things are different. But there are some fundamental things that I think should be common denominators. When you do the minimal of that, you can go a long way to preventing some of the surges that we've seen. Right.
Finally, on the vaccine, any new update? It seems as if the consensus is something in the spring. Is that would be out to at least a large chunk of the population? Is that still the most realistic timeline, or is that still a little ambitious?
No, I think it's quite realistic, Chuck. Right now, we have at least 2 of the 6 vaccines that the federal government has made a major investment in. 5 of them are in phase 3 trial, which is the large trial to determine if the vaccine is effective and also safe. 2 of these started the trial on July 27th, and they're fully enrolled, ready to collecting a lot of data. And the projection I've made, and I think I made it with you on Meet the Press some time ago, is that sometime in November or December, most likely the end of November, the beginning of December, we'll know that a vaccine is safe and effective. And I'm cautiously optimistic that it will be. There will be doses that are already made and ready to go at the end of the year. But if you talk logistically about getting it to the major proportion of the population, that will be obviously several months into 2021. But vaccine doses will likely start to be distributed on a priority basis, for example, to healthcare workers and those who are most vulnerable, could be very much by the end of this year, the beginning of the year. But when you talk about hundreds of millions of people, you're really talking about several months into 2021.
Dr. Anthony Fauci, I always have more questions, but I don't always have more time. And neither do you. You're a pretty busy guy. So thanks for spending a few minutes with me and with our viewers today. Thank you, sir.
Thank you, Chuck. Good to be with you.
Hello, YouTubers. If you're watching this, it means you've checked out our channel. So thank you. Now do me a favor. Subscribe by clicking on that button down there. Click on any of the videos to watch the latest interviews and highlights from MTP Daily and MSNBC. You can get more Meet the Press content every morning in the First Read newsletter. If you're tired of content that you don't know anything about where it came from, you don't have to have that problem with us. NBC News, MSNBC, MTP, and the Meet the Press mindset right here for you on YouTube. Subscribe now.